Hello, and welcome to Office Hours Quality Payment Program QPP webinar and conference call. My name is Maisha. I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the question-and-answer session, if you have a question, please press star, then 1 on your touch-tone phone. I would now like to turn the call over to Candy Hansen. Candy Hansen, you may begin.
Thank you, Maisha. Hello, everyone. As Maisha said, I'm Candy Hansen. I am a program manager and QPP subject matter expert with the Lake Superior Quality Innovation Network. And that network serves Minnesota, Michigan, and Wisconsin under the Center for Medicare and Medicaid Services Quality Improvement Organization Program. I want to welcome you to today's session of the QPP office hours. As Maisha said, today's call is operator assisted, and everyone's phones are currently muted to avoid background noise. Since this is an open office hours call, it's kind of a hybrid call where we're going to do more of a didactic presentation of the 2018 final rule overview, and then there will be opportunities to ask questions over the phone, at which time Maisha will provide instructions. Lori is going to be monitoring the chat box throughout the presentation. However, we're going to try to get through the presentation first and then get to our questions. Please note that the information provided during this session is based on the latest information made available by CMS and is subject to change. CMS policies change, as you probably all know, and so we encourage you to review specific statutes and regulations that may apply for interpretations and updates. Also, the CMS Resource Center is updated frequently with resources, so we would encourage you to stay current with those as well. At the end of this office hours, you'll have the opportunity to complete a brief evaluation, and as always, we would appreciate your feedback about this event and suggestions for future educational opportunities. We'd also like to remind those of you that received direct technical assistance related to QPP to please take time to complete our evaluations sent at the end of each technical assistance encounter. Again, your feedback is valuable and allows us to gauge how we're doing in regards to meeting your needs in a timely and courteous manner. I'd like to mention that during the office hours calls, we typically can address a broad range of questions, which are based on the equally broad range of QPP knowledge level of our call participants. Some of the questions we can answer quickly, and others, as you well know, require some additional time to research due to the complexity of the questions. While others will be scenarios that are specific to your organization. Our team is implementing a new process to capture all of the questions and answers presented during these calls, and questions that our team deems broad and applicable to all of the audience will be mailed to participants within 2 weeks of the event. Those that are a specific scenario, our team will address directly with the attendee via email or phone. Finally, questions that require more research or those that appear frequently will be addressed at our next office hours. So with that, I would like to get going with the presentation. And so we'll go ahead and get started. I have Lisa Gall in the room with me also as one of the subject matter experts. We have Lori Mantipol from Wisconsin, who is monitoring the chat box, and Holly Standard from Michigan, who's also another subject matter expert. So here we go. That's just our disclaimer again. If you don't know who we are, the Lake Superior Innovation Network is a partnership of these 3 quality improvement organizations, Stratus Health, Medistar, and MPRO. So for today, we want you to understand the changes to the quality payment program for 2018, including eligibility changes, summarize important deadlines, and learn how to estimate your merit-based incentive payment system score to help you set improvement goals for 2018. So for 2018, there are no changes in the types of clinicians eligible to participate in 2018. Those 5 clinician types are listed here. Just something to keep in mind, in the final rule from 2017, it did say that CMS has the authority to add other clinician types in for 2019, so we'll be watching for that. So for year two, one of the biggest changes to the quality payment program is that the low volume threshold increased to eligible clinicians billing more than $90,000 a year in the Medicare Part B allowed charges and providing care for more than 200 Medicare patients a year. As you can see, that was a significant change from 2017. Voluntary reporting remains an option for clinicians. However, if you do choose to report voluntarily, you are not subject to either a negative or a positive payment adjustment at this time. There's no change in the basic MIPS exemption criteria. Those that are first year enrolled in Medicare, those that are significantly participating in an advanced alternative payment model who are qualified participants, and then again the low volume threshold. For 2018, special status and special scoring doesn't change for non-patient criteria. So individuals that have less than or equal to 100 patient-facing encounters, groups that see more than 75% of their clinicians in a group are non-patient facing. There are no changes to special status for small, underserved, and rural, although, as I'll say later on as well, those clinicians in practices of 15 or fewer are considered small and actually automatically receive a 5-point bonus just for being in a group of less than 15. The reporting options for 2018 are the same for individual or as a group. As you know, the group is 2 or more clinicians who have reassigned their billing rights to a single PIN. And the third option for 2018 is called a virtual group. And that virtual group is made up of solo practitioners and groups of 10 or fewer eligible clinicians who come together virtually to participate in MIPS for a performance period during the year. Clinicians participating as a group are assessed as a group across all 4 MIPS performance categories. This same is true for clinicians participating as a virtual group. So the 2 paths for the quality payment program, the first one is alternative payment models and advanced alternative payment models. Alternative payment models are, as you know, new models paying for healthcare that incentivize quality and value over volume by moving away from traditional Medicare Part B physician fee service. They're generally models that have only upside risk. So ACOs, MSSP, Track 1 is an example of an alternative payment model that's MIPS eligible. Advanced APMs are a subset of APMs, and those are also assuming downside risk. So MSSP Tracks 2 and 3, 1+ as well for this year. Next Gen are examples of advanced APMs. And those advanced APMs, qualified professionals automatically receive a 5% bonus payment and do not have to report to MIPS. Those are just the 3 statutory requirements for being an advanced APM. So MIPS APMs, as I said, are alternative payment models in which there's only upside risk. So there's still an APM is still a MIPS APM. It's kind of the middle ground between reporting just to MIPS and being a full-fledged advanced APM. So the path 2, so the merit-based incentive payment system. As you can see, here's another change from 2017 to 2018. Quality has been decreased to 50% from 60% in 2017, and the reason for that is that cost has become a 4th category for 2018. It starts out at 10%. It will statutorily go to 30%, but CMS has a little bit of a little bit of wiggle room about how they're going to get to that 30%. So we won't know what that percentage will be next year until we see the final rule the proposed rule that will be out in the next couple of months. So one of the biggest changes in name only is that the Advancing Care Information category of MIPS has now been changed recently to the category name of Promoting Interoperability. So in Promoting Interoperability / old ACI, the maximum category score is 100. You can truly earn 155 points, but the maximum is 100. There are actually some additional bonus points for 2018. In 2018, you still can use either 2014 or 2015 Certified Electronic Health Record Technology. But if you use 2015 CERT exclusively, you're eligible for a 10% bonus. For Promoting Interoperability, there are base measures that are required for any score in this category. If you meet the requirements of the base measures, you automatically earn the first 50 points. And then in 2014 CERT, there's 4 base measures. In 2015 CERT, there's 5 base measures. Some measures also earn a performance score. There are, as there were in 2017, 2 exclusions for 2 base measures. For e-prescribing and health information exchange, sending the summary of care, if your denominator is less than 100, you are able to do an exclusion for those. Performance measures are optional. You can earn an additional up to 90 points. Again, 7 measures for 2014 CERT and 9 measures for 2015 CERT. So the bonus points, there's some additional bonus points to be had in 2018. You could earn 15% in 2017, and now in 2018 you can actually earn 25%. 10% you get for using 2015 CERT exclusively, and if you use CERT for the one of the eligible improvement activities, you earn a additional 10%. If you report to one public health or clinical registry, you get 10 points or 10%. And then if you report to an additional public health or clinical registry, you get an additional 5%. So, okay, quality. The quality category, as I said, is weighted at 50% of your MIPS score in 2018. You, again, still earn 60 quality category points. You're choosing your 6 measures that you can either do from a specialty set or just from all of the measures that are listed there. You must choose one outcome or high priority measure. You earn 3 to 10 category points for measures with benchmarks. If you are in a small setting, there are measures that are topping out. CMS is topping out measures in a transitional 2-year period. There are 6 measures for 2018 that have been topped out for 2 or more years, and those measures earn a maximum only of 7 points. The data completeness threshold has been increased from 50% to 60%, and if you are over 15 or 16 or more in a setting of more than 16 clinicians, you will only earn 1 point if data completeness is not met. Small practices still earn the minimum of 3 points. There is still our bonus points for reporting end-to-end electronically, and bonus points for reporting additional outcome or high priority measures. There's a new scoring bonus in the quality category, which is worth up to 10 percentage points. It's based on improvements in the total category score. It's not measure by measure, and of course, higher improvements result in more points. The reporting methods have not changed for claims, EHR registry, qualified clinical data registry, and CMS web interface. If you're reporting via CMS web interface. You must register to do so if you have not done so in the past. That registration is open now through June 30th, not July. If you're in an ACO, your ACO will take the responsibility for making sure that your web interface, that your registration for group reporting has been completed. If you have reported via web interface before last year, you should not have to register again as a group. You should be automatically re-registered, I should say. Improvement activities category. There's some changes to that. There are additional activities that have been added for 2018. Some of the activities have changed. Some of them have changed in their weighting, and a few of them have changed in their wording. So you really want to pay attention to those activities. The question has come up, can I choose the same improvement activities that I did last year for this year? And we have not found that that's not allowable. I will say, as I've gone through the activities list, that there are a couple of activities that say that you can only choose this activity every 4 years. So you'll really want to pay attention to that. So while you can overall choose the same activity, you want to really look at your activity specification just to make sure, or it's not a specification, but your activity description to make sure that it doesn't have a limitation on it. You'll engage in up to 4 activities for at least 90 days for the improvement activities category. Medium activities are worth 10 points. High activities are worth 20 points. Again, you'll earn promoting interoperability category bonus points for using CERT. There are 26 activities, up from 19 in 2017, that are eligible for the bonus CERT in the promoting interoperability category. And that's done simply by doing a yes-no attestation. Special scoring, you get full credit if you are in a patient-centered medical home or medical home deemed status, such as Minnesota. Medicare Shared Savings Program and NextGen, you get half credit for clinicians and other APMs and double points for small, underserved rural settings or non-patient facing. So the 4th category added in this year is the cost category. This category is a composite NIPS score. Included in the composite NIPS score beginning this year, there are 2 measure scores that are averaged, or 1 if there's only 1 available. The first one is Medicare spending per beneficiary, and the second one is the total per capita cost measure. As I mentioned before, the category weight will increase 30% by 2021. There is no data submission required. It's calculated from administrative claims if the case minimum of attributed patients is met. The benchmark is calculated using your current year performance, and that there is a new scoring improvement bonus of up to 1 percentage point based on statistically significant changes at the measure level. Your information for your cost category, we're thinking is going to be coming out this summer. So you have some indication of what your cost category score might be. So now, talking about NIPS scoring and reporting, there's some changes for 2018. There is not a pick your pace option in 2018, so you will have to be for a minimum of 90 days for improvement activities and promoting interoperability, former ACI. Quality and cost, however, will be for a full performance year for 2018. Here's one of the biggest difference in scoring, where 3 points was the neutral payment adjustment threshold in 2017. That threshold has been increased to 15 points for 2018. And then again, there's negative payment adjustments based on where you end up scoring in 2018 if you are below the 15 points. Again, if you participated last year, it shouldn't be and you were fairly successful, it shouldn't be too hard to get to that 15 points. There's a variety of, ways to look at getting to that 15 points. But the exceptional care bonus is still eligible for those folks who score 70 and above. So there are new bonuses that have also been added in 2018. You must report on at least one MIPS category. And then in order to get one of these bonuses, and the bonus is added to the final MIPS score. So there's a complex patient bonus, which gives you up to 5 bonus points for treating complex patients. The score is based on the hierarchical condition category risk score and a percentage of dual eligible beneficiaries. There's also, as I mentioned before, a small practice bonus. 5 points are added to the final score of any MIPS eligible clinician or group in a setting of fewer than 15 clinicians. So, steps to success in the quality payment program. You're going to determine your eligible clinicians. Now, this year, you probably already know that the CMS is not sending out letters, eligibility letters. You actually have to go to the NPI lookup tool, and you can look up your clinicians by TIN or by individual clinician, and that's how you will determine what if, for example, what practice setting CMS has designated the clinicians, as well. Let's see. Yeah, that's where you'll find out what status the clinician is in and whether or not the person meets the low volume threshold. So you want to determine your path. Are you going to be in an APM as a group, or are you going to be doing MIPS? And if you're going to be doing MIPS, are you going to be doing it as an individual or as a group? And hopefully you've all been collecting data already in the quality categories, and then just really getting your data together for the 3 categories that you will be reporting or attesting to. Then you're going to review your current performance, choose your reporting periods for promoting interoperability and improvement activities, evaluate your available reporting methods, choose either group or individual performance. And how are you going to do that? What's a really good way to be able to do that? Well, the 2018 Stratus Health MIPS Estimator has gone live, and it is available at the same address as the 2017 one. If you haven't used it before, it is educational, it's interactive, it's got many links to CMS and other resources throughout the tool, and you have an opportunity to view an example report before you actually create your account to go in. So it's designed so that if you bring all of your data to the tool, that you shouldn't have to leave the tool until you have your score. Anything that you might not quite fully understand should have a link so that you can get more information if you need it. So here's an example of an estimated individual MIPS score, and if you enter in your individual, the calculator will, or the estimator will calculate a group score for you as well based on the individual scores. So you can compare your scores across various reporting methods, and again, it'll tell you individual or group, so you can really see how you're going to fare best by which data submission method and whether or not you're reporting as an individual or as a group. And again, here's just an example of some individuals, and then what happens is that the estimator groups the MIPS score on the bottom. We've added some features and functionality this year. We want you to be able to view, in addition to printing your results or downloading or viewing reports, to save your test. You can save a test report if you want to do some scenario testing, and then you can save an actual report as well. And then here's just how the scores end up showing up. And this must have been for someone who was reweighted. Due for the promoting interoperability category, you can see the small practice bonus and the complex patient bonus. In the MIPS estimator for 2018, the complex patient bonus and the quality category improvement score. We are asking you to self-rate those this year. The calculations are very complex, and until we have worked through what those calculations are and really have an understanding, same thing for your cost category that's self-rated for 2018, until we have a better idea of how all those calculations work out in 2018. So these next two slides are just basic resource slides for you so that you can see at a glance what the differences are from the 2017 transition year to the 2018 year 2 changes. So we've got lots of resources and tools for you. The Lake Superior Quality Innovation Network has lots of resources and tools for you. If you're a small practice, there's QPP SIRS that offers assistance to you. There's the address for the Stratus Health MIPS estimator. There's just some other additional resources from the CMS website and the help desk. And for the future, we have office hours coming up on Thursday, June 21st and Thursday, July 19th. So you'll be getting notices about those as well. And finally here, we all have help desks in our individual state. Is that a typo in Metastar? Yeah, it shouldn't have a start. Sorry about that. It's QPP@metastar.com, not start. And so those are our help desk emails where you're always welcome to pose a question, and one of the subject matter experts in each of the states will get back to you. So, Maisha, that ends the didactic portion of this webinar. Maisha, if you could give us instructions for answering questions. Lori, I'm not seeing anything in chat. Is there anything in chat?
No, I do not see anything in chat at this time.
Okay, so now we're just going to open it up. Maisha will give us instructions, and then we will answer your questions.
Thank you. We will now begin the question and answer session. If you have a question, please press star then 1 on your touch-tone phone. If your question has been answered or you wish to remove yourself from the Q&A queue, please press the pound sign or the hash key. There will be a delay before the first question is announced. If you are using a speakerphone, you may need to pick up your handset first before pressing the numbers. Once again, if you have a question or a comment, that is star then 1 on your touch-tone phone. We are now awaiting any questions. And once again, ladies and gentlemen, for any questions or comments, it is star 1 on your touch-tone phone.
You're also welcome to type in a question in chat if you would prefer not to go onto the phone. I can't believe the group doesn't have any questions.
Candy, while we're waiting for questions from the group, you know, one thing that did come up as a question here recently, I know that maybe others have, is around, you know, when do you need to decide on your quality measures and your improvement activities? Are there deadlines?
Well, for quality, of course, and please feel free to jump in as well, Lori, but I mean, for quality, as quality is being assessed over the entire 2018 performance year, hopefully before the data submission, or shortly after the data submission deadline passed, you already knew what quality measures you were focusing on for 2018. For improvement activities, unless the activity specifies more than 90 days, and there's a few that it does require 6 months of participation, you just have to decide. If it were me, I would, just choose an activity that, that might go across the entire year, so you can just choose which 90-day period, or if you want to do it for an entire year. But, just really looking at your current workflow. Try not to make additional work for yourself in order to be compliant with the quality payment program. Another question thank you, Lori. Another question that came up earlier this week is that you can go to the QPP portal now to see what your 2017 performance looks like. But what we're hearing across several people who have looked are concerned that the data that they're seeing does not either include their entire group, only some individuals that they ended up attesting or reporting for. In one case, I saw a report where it appeared that none of the individuals that were listed had successfully reported, and so that was an alarming find as well. What we learned after we initially started talking about that this week is that that's a work in progress. I had someone call CMS to say, hey, this is not what I reported on. And basically CMS said, well, you're just going to, you have to wait until July, until the final data comes out to see if it's correct. And then if it's not, of course, you're going to have to go through the informal review process. But the person that we talked to earlier this week, while we were on the conference call, she got back up on the QPP portal and she's like, oh, okay, now my data's right. So just so you know, for 2017, it is a work in progress.
This is Lisa. I want to add a little bit onto that. Lisa Dahl from Stratus Health. And I had a question in our help desk yesterday where they asked CMS about the discrepancy in the number of clinicians in their organization. And CMS had answered to them that they're actually realizing now that after they've published it that there are a lot of errors and that they're continuing to work and fix on that over the next, they didn't really say how long that would take, but they're aware of the issue. However, I think if you do have an issue with how your clinicians are looking in your file, you will want to and not to bombard CMS, but to make them aware. Either you can be patient and wait and keep checking, but by, I would say by June, if you're not still straightened out, you should contact CMS. Apparently the names got flipped around too. A lot of maiden names are still in the files, and so people aren't recognizing the names of their clinicians.
Thanks, Lisa.
Yeah.
As a reminder, ladies and gentlemen, for any questions, it's star 1 on your touch-tone phone.
Lori, I'm still not seeing anything in chat. Is that correct?
No, I also am not seeing anything in chat, Candy.
Okay.
We do have a question.
Sure.
Unel Protect, your line is now open. Please go ahead.
Hi, this is Dana from Hutchinson Health. We are wondering if, as we look at each of our individual clinicians, if we look at them up in the NPI lookup and we're looking at that parameter of the last year, less than 30,000, now this year, less than 90,000, if all of our individual clinicians don't meet that parameter for that dollar amount, what does that mean for us? Would we still need to submit as a group?
So if I'm understanding your question right, Dana, so if in fact it says on the NPI lookup tool that each of your individual providers do not meet the low volume threshold, but it says that as a group, you could meet or you could be eligible to report. Is that what I'm understanding, Dana? Yeah. So what that means is then that you're just going to have to, you want to make a decision. It depends on, I would say that it depends on how well your clinicians do as a group. So, for example, I would encourage you to either, to enter in, I can't remember, Dana, how many eligible clinicians you have, but you could either aggregate all your data and throw it into the MIPS estimator, or you could enter in all your individuals and it'll aggregate it for you, depending on how many clinicians you have. And then you'll see where it looks like you're going to score. So, and then what does that mean to you, right? So if in fact you're going to be scoring 70 and above because your clinicians are doing so well, depending on the amount of work that it takes, why wouldn't you want to apply for that exceptional, to be a part of that exceptional care bonus as well as a positive payment adjustment? It's kind of really just an individualized decision for yourself, whereas if you're, 15 or, 16 to 69, you're still eligible for a positive payment adjustment. We haven't heard. Now, last year we did hear that the amount of positive payment adjustment just before the 70 group was going to be pretty minimal because CMS was really expecting, because of offering the pick your pace option, that there would, and since the positive payment adjustment is budget neutral, that there would be not very much money to be had in the positive payment adjustment arena. Now, we haven't heard, unless you guys have all heard.
Actually, this is Lisa again, and so I did read in the final rule when I was doing some digging that they anticipate about that the negatives and positives should equally weigh out this year, with raising the score to 15, that they believe that there's going to be more negative, payment adjustments, as many negative as there would be between the normal positives.
Okay, so then there will be more money to be had if that,
if that prediction is true.
Yeah, if that bears itself out. So, does that answer your question, Dana?
So in summary, I think you're saying it might benefit us to do that, but we won't necessarily be required to, but why wouldn't we want to try if we're scoring well, correct?
Right. Yeah. I mean, like I said, it really just depends on how well your group is doing.
Very good. Yep, that does help. Thank you.
Okay. And the other piece of that is that your clinicians who are ineligible as individuals will not get a payment adjustment at all unless they report with the group, and then they would be subject to the group's payment adjustment.
Right.
So, so that it could benefit you if you're doing well as a group to report.
Yep. So Reed Hazy, who's also one of Stratus Health's subject matter experts, says, just a point of clarification, it may be worth mentioning that while ACI has been renamed to promoting interoperability for 2018, none of the objectives or measures, scoring, et cetera, will change. It's just a rebranding at this point. You might also want to point out that meaningful use I was thinking about that, Reed. So promoting interoperability has been renamed both at the federal level, at the
QPP level under the category is promoting interoperability category, but the EHR incentive program is promoting interoperability program. So there's a program and there's a category.
Right. So it's a little confusing, and the timing wasn't probably, the timing didn't help add clarity to it as well. So thanks, Reed. Other questions?
As a reminder, it's still star 1 on your touch-tone phone for any questions or comments.
So I'll wait just a minute to see if we have any other questions. If we don't, we will certainly give you back the gift of time. I want to encourage anyone who maybe didn't get a question answered. It's always difficult when you get a lot of information at first, but to reach out to your individual state for technical assistance through the help desks that are available to you. So with that, if we don't hear anything else, I want to thank everyone for joining us today. As I mentioned before, we'll compile and vet the questions. Of course, we only had a couple of questions posted today and email you answers, contact you directly, or present the responses for more detailed and research-intense questions at our next office hours call. If you would take a minute once we get out of the webinar to please complete the evaluation when you close out of the webinar. Again, your feedback is much appreciated and used to inform our future educational offerings and development, our resource development. So thank you so much, everybody. Just one last go-round. Lori, you're not seeing anything else?
No. One quick thing I just wanted to point out, Candy, is that I just noticed a little typo here on the help desk emails. In the state of Wisconsin, it's QPP@metastar.com, and I did put that in the chat as well.
Okay, great. Yep. Oh, EID. Yeah, just a reminder, there was a lot of challenges with the EIDM accounts last year. So, again, just encouraging you to go in and just make sure your information's correct and that you're able to get in early on so that hopefully that isn't quite as challenging for the 2018 year.
Yeah, and there's a lot of resources now available on QPP Resource Center about getting the correct EIDM account. So we would encourage you to make sure you go in and make sure that you have enough people in your organization to have EIDM accounts that have access, can upload, so it's not all on one person in case something were to happen.
Yep. So thanks, everybody. We appreciate you joining us, and we'll talk to you next month.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you all for participating. You may now